Hi, good afternoon, everyone. My name is Lavernia, and I'm gonna be your nurse practitioner for today. So first, we need to congratulate the newly parent and ask why they're here for today. So this is a 10-day-old male child of full term 40 weeks delivered via normal vaginal delivery to a 33-year-old premigravida um, premigravida mom who this baby did not stay in the NICU. And also mom said that the baby cries immediately after birth and uh, past meconium on after the delivery. Baby weighs 7.6 pounds and there's no yellowish of the skin in the hospital, and received hepatitis B and vitamin K shots. And so during prenatal history, mom did not skip any prenatal visits, received calcium, iron supplements, and tetanus vaccine, and denies of any history of fever or rash or leaking of amniotic fluid, and any medical history of uh, like gestational diabetes or hypertension. And um, so the mom said that she latched on the baby in the hospital after delivery within 1.5 hours. And right now she's doing breastfeeding every 2 hours for 30 minutes and passes meconium, not meconium, sorry, a pasty um a pasty stool that's colored yellowish, and just reassure the mom that that is normal, and for especially for breastfeeding, and she changes diapers 8 times a day. So and so now the baby weighs 7.10 pounds, and the height is 55 centimeters. So the temperature of our baby is 97.8 pounds, and the blood pressure is 67 over 45. So now we're gonna check for the general appearance. So when we check the baby, they're only in the diaper. So when we check for the umbilical cord, make sure that the diaper is not above the umbilical cord. um Tell the mom that always keep it clean and dry, don't pull it out because it will fall off in between 10 to 14 days. It will fall off on its own. Check for any yellowish of the skin. If the baby, check the general appearance of the baby. That right now our baby is asleep and calm, and there's no signs of distress, no nasal flaring or retractions. And also if there's a small rash which is called erythema toxicum, which is a yellowish yellow white papules with erythema on the base. That's normal. Just tell the mom that it will be gone in a few days. So also check for any birthmarks, and we'll just monitor on it. Check for any skin tags and the baby. So next we're gonna do for the head of our baby. So we're gonna measure the head of the baby using our tape measure. So we're gonna use this, round it to the very prominent part of our occiput and above the eyebrow. So our baby's head is 33 centimeter, which is normal. And when we check the baby's head, we check the anterior fontanelles, which is the diamond part. This will close between 9 to 18 months. This is very fragile, so just make sure, educate the mom that this should be flat. If it's depressed, then it means it's dehydration. And also check for the posterior fontanelle, which is in here, which is a triangular shape. This will close between 2 to 4 months. And then check for any swelling of the head of the baby, which is called caput succedanum, which is swelling of the head due to the in the birth canal. and the caput, the cephalohematoma, which is the bruising that doesn't cross the sutures of the head. So just tell them that, just educate the mom that there's no medical interventions, and that it will be gone on its own. And also, check for the molding of the hand. Sometimes it's a cone shape, which our baby has a cone shape right now. Just educate our parent that that's normal, because during the in the birth canal, and it will turn, reshape it to the circle. If it's not, then we might do a cranial molding on it. So look at the, next is check for the face of the baby. So we're gonna do for the ears, so we'll draw an imaginary line from the outer contours of the eye to the upper portion of our pinna in here. So make sure that this pinna is not below that imaginary line. If not, then it's a low set, then it might be a congenital anomaly. And also check the ears rim in here, make sure this is fully with skin, and check for the helix, and check for the cruise, which is, this is the cruise. Check it if it's smooth or uh folded. So if it's folded, it might be a defect, but it's, and then, so check for any pits and tag. Always check the babies bilaterally. It needs to be symmetrical. So check for any pits or tags in here. Our baby is good. So now we'll check for the eye spacing of the eyes, so the widening of the eye spacing, and also check for the palpebral fissures of the eyes. So sometimes it is sometimes it's upwards or downwards, but it's normal for the baby, because it might be, they might inherit it to their healthy parents. And also check for the conjunctiva and the yellowish of the sclera. So now our baby is awake. We will use our ophthalmoscope to check, always check the read reflex. When we check the read reflex of the baby, it needs to be symmetrical. If it's not symmetrical, if it's asymmetry and we saw a white spots on the eye, it means a congenital anomaly. It might be a congenital cataract or retinoblastoma. And sometimes we see that there's a missing tissue in the eyes that called coloboma. So we need to refer them right away to the ENT. And so now we will check the nose of the baby. So in the nose, we check for the patency of the nose. We always check for nasal flaring. Babies are nasal breather. So ask the mom if the baby has a history of distress, or when they cry, they hear grunting or wheezing. So when we check the baby's nasal, we kind of occlude it a little bit, or you can use your stethoscope also. When you use your stethoscope, make sure that don't put it really close to it. You can only hear like like a sound of an air. And so after that, we check already the nose. Check also for nasal deviation of the nasal deviation of the nose. So now we'll check the mouth of the baby. Make sure that it's moisture, and then check for any Epstein pearls. Epstein pearls is like a white spots in the gums, and just educate the mom that that's normal. It will be gone in few days. And also also check, we will put our glove finger in our baby's mouth. We can insert it slowly, and feel the palate, the upper portion of our palate, to check if there's a cleft palate on it, and then the cleft, which we can see in here, the cleft. And also check for any neonatal tooth. If it's not interfering the breastfeeding, then that's okay, we don't need to take it out. And also make sure that the tongue of the baby will pass through the gums. If not, then it might be ankyloglossia, which is a tongue tied, and also the frenotomy or release of the frenulum may be needed, because it when during breastfeeding it hurts. So now we're gonna check for the neck of the baby. So when we check for the neck of the baby, we just check for if there's any folding or webbing of it. It might be congenital syndrome. So just run your fingers to the clavicles also of the baby. Make sure there's no, so the clavicles of the baby in here, so make sure there's no crepitus or like broken clavicle. Especially for breech baby, they might have a broken clavicle due to the force of delivery using instruments. And so now we're gonna check for the chest. So our chest, we need to measure again the chest circumference of our baby. So in the in in the nipple area, so it's 31. So it's normal to have less than 2 to 3 centimeters to the size of our head. That's pretty normal for the child. So then we will check for the sternum, if it's flat, if it's concave, then or convex. So convex is convex, it might be common to those cardiac anomaly, so we need to refer them to cardiologist. So now we're gonna check for the heart rate of the baby. So we're gonna use our bell on it and check it in their apical, in their apex. So we're gonna do it in here below their nipple line. We need to listen it in 1 full minute. So our baby's heart rate right now is 140. So the normal is 100 to 190. And check for any murmurs on it and the baby. And then now we're gonna listen to the lungs of our baby. Let's listen for any grunting or wheezing. And then we'll look at the back. Okay, so we'll listen, and then we'll look at for the rise and fall of the abdomen. That's how we check the respiration. So we need to count them in 1 full minute, because the baby can pause their breathing, and when they make sure that it's not greater than 20 seconds pause, if because it's normal to pause the it's normal to have a pause on their breathing, but not really, as what I said, it's not gonna be greater than 20 seconds. So our baby's respiration rate right now is 42, and that's normal. So now we're gonna check for our abdomen. So first we're gonna check if it's distended. We want our baby's abdomen to be soft, not too hard. And we already checked our what you call this one, the umbilical cord. And if we can see our umbilical hernia, if we push it, and if it's hard to push it, like incarcerated, we need to refer them to surgery department. And so our baby is good, good in that. So we will and auscultate the abdomen of the baby. So we will listen to the bowel sounds. Okay, so that's good. And also when we listen to the bowel sound, we can do palpation in the baby. So it's normal to palpate the liver. So the liver will extend to 2 to 3 centimeters in the rib external in the edge of the rib cage. That's normal. And sometimes we can palpate the kidneys. So now we check already the abdomen, and then we will check the groin of our baby. So we'll take off the imaginary diaper. So we will check bilaterally their femoral pulse. Make sure they're bilaterally strong, and then brachial, and the femoral in here. Make sure they're strong. If now one is weak and one is strong, it might be a congenital defect. And then now we check for our baby. Since our baby is a male, we need to palpate the the what you call it, the scrotum. Make sure it's on it's descended testis. And then check for any hernia. Make sure that check for any curvature of the penis, and make sure that the foreskin is covered, the whole glands on it. And also if it's swelling, it's accumulation of fluid, which is called hydrocele. So we will monitor for that. And then we need to do like tests for to confirm it. And then so next is the hip. We will check for hip dysplasia of the baby. So we will do, there's two types of this. We will do Barlow maneuver, which is we will pull outside, which is, and then we extend it, and then push it, and then if we hear a click, then it's positive, right? We will, right, in the midline, and then push it. If we hear, then that's positive. And then we do ortolani. So we will do like a 90-degree, and then we kind of do abduction, and then once we hear a pop, then that's positive with ortolani sign. So after that, we need to check also for the anus of baby. So we know already that our baby has a patent anus, because he's already passing stools per mom's report. So, and then so we will do now check the back of our baby. So when we check the back of the baby, make sure that there's no it's visible to have a dimple of the back. And then if not, then it's gonna be a spinal deformity. So next is the extremity of the baby. Make sure that they have 10 fingers, 10 toes. And also we need to look at their tone. We don't want them to be fluffy. We don't want them to be like super toned. So the babies, it's normal for the baby to, when we extend them and then they curl it back, so that's normal to them. So it's like we extend them and then they curl it back, extend and curl. That's normal for the baby. So now we will do we check already the back of our baby. Make sure check for any discoloration in it, which we already did. And then if the dimples. And then now we're gonna check for our neurologic. So now our baby is awake, and then he's not floppy, he's not hypotonic. So now we will do the primitive reflex. So we will hold the baby and we kind of startle them. So when we startle them, since they're always curled, when we startle them, they will extend their hand. So that's positive with it. So now we're gonna do the rooting reflex. We will just stroke this side of in the cheek, and then they will follow like this, where it was stroked, or in this side they will follow on it. And then also the sucking, which we already did a while ago. When I did check the palate, the baby is already sucking. We can do that again, so the baby will suck my finger. Now we will check for the palmar reflex. So the baby will have a close grip on my finger. And also the plantar reflex, they will curl like this. And then the Babinski, we will draw an inverted J, and then they will fan their toes, and the big toe will extend. The same thing in here, we will do the same, and they will like this. And then So the asymmetric tonic reflex. So once you turn the head of the baby, let's say to in this side, this one will extend, and then this one will flex. So it's like a fencing reflex. So can I don't know, my baby is like this. Okay, like a fencing reflex. And then next is the stepping reflex. So the stepping reflex is we kind of lift the baby, and then they will like walking in the air. So that's positive with stepping reflex. So now we're gonna make sure that educate the mom for the next visit that the baby will receive few vaccines for the second dose of the hepatitis B, and then first dose of Tdap, pneumonia, polio, Hep, rotavirus. So educate them how important is the immunization. So, and then also the anticipatory guidelines is that make sure that the baby is always in the safe place. Don't put a lot of stuff in their head or in their crib. Don't put a lot of blankets on them. Always keep them dry and clean. Don't use any harsh soaps or any harsh lotions. And also tell them to try to talk to their baby, because that's the good time to, because their baby is still forming their brain. It helps them the brain development, I mean. And then ask them if they need financial help or if they need like quick ask if they have like a postpartum depression, of how, ask the mom if they have lack of sleep, and then or any depression, or ask them for if the environment is safe, and like if they're like abuse, all those stuff, or alcohol or substance abuse, or um and that's pretty much it. Ask them if they have any questions, wash your hands, and then record what we had. And that's it. Thank you.